Hi, today our practice will be on opening the hips. The hip joints, right here where your big thigh bone comes into your pelvis. We'll be doing some exploring there. So first thing, separate your legs so that the sole of one foot is on the inside of the other thigh, the opposite thigh. And adjust yourself so that this feels stable, so that one hip isn't way up in the air or one sitting bone isn't way up in the air. If that's the case, you can take a blanket, tuck it under the opposite hip, or it might feel better to you to take the blanket under the hip that's in the air. So find that comfortable position. Oh, I want to say this too. You might prefer to have your leg extended, which is fine. So whichever way. Take your hand and place it on the hip. Good. Opposite fingertips are on the floor right beside you. Get in sync with your breath. So just notice when you're inhaling and when you're exhaling. And on an inhalation, gently press the hip joint forward. And then on the exhalation, guide the sitting bone, the bottom back down. So we inhale, press it forward, and exhale, come on back down. So notice I'm keeping the front body, the torso, pretty stationary. So meaning I'm not twisting. I'm not coming up and twisting. So keeping the upper body, the torso, relatively straight and stable. And when you do that, you'll feel more sensation. So you can minimize that amount of sensation by not lifting the hip up as high. Good. Let's do two more. And we'll switch to the other side. If you're using props, just move those out of the way and reposition yourself so that your body feels stable. So under the knee, under the sitting bone, however it works for you. And opposite hand to opposite hip joint. Get in sync with your breath. And on the inhalation part of the cycle of breath, press your hip joint forward. So I'm talking about the hip joint, not the outside of the hip. So that joint, imagine it pressing forward. You might notice sensation in other parts of the body, right? You might notice the inner thigh. You might notice the bottom. So everything's connected, but makes perfect sense. And what I feel in my body might be different from what you feel in your body. Let's do this a couple more times. I say that because a lot of times students ask, well, where should I be feeling that? And my answer is, well, where do you feel it? because your body's the best teacher. And your body's always right. I could be wrong. Let your feet come pretty wide apart. Let me scoot back so you can see my feet. Pretty wide apart with your hands on the tops of your knees. Good. Feel the sitting bones on your mat, and then consciously lift the heart, the center of your chest, your sternum up. Yeah. Get in sync with your breath, and then on the exhalation, let your knees drop towards the floor on one side. And notice I didn't say to the floor, right? Everybody's different. Your knees might come, 6 inches away from the floor, or you might come an inch from the floor. Maybe you can come all the way down to the floor. It doesn't matter. What matters is that You don't feel any pain, nothing that makes you go ouch in your knees or your hips. So the movement is just right for you. And it's movement we coordinate with breath. Next time the knees are coming up, we'll come back to a seated cross-legged position. Let your hands rest on top of your knees or thighs and begin to circle your upper body, your torso. And as you're circling, you might notice or become aware of some resistance in your body, especially in your hips. But you also might notice some ease, right? You might notice, well, that was way easier than I thought, especially when we turn and move in the opposite direction. It's rare that things feel the same on one side as they do in the other. So really checking in and noticing. And we'll come on back to center. Take a deep breath in through your nose and just let it out. We'll come to a kneeling position with the knees under the hips and the palms under the shoulders. Keep a little bend in your knees, a little bend in your elbows. Yeah, and have the inner surfaces of your palms pressing down onto the mat. We'll root down through one knee, just pick one, and then lift the other knee up in the air. Just let it rise up to where it feels sustainable. So maybe your knee can come as high as your hip, maybe lower, but try to keep it at least parallel with the hip. Oh, what I really mean to say is don't go higher than your hip. Let's come down onto a forearm if that works better in your wrists. And you'll notice the sensations coming into your body. You'll notice what you're feeling and where you're feeling it. It's pretty dramatic. And when those feelings are not sustainable anymore, begin to circle the knee. So circle it in and circle it out. So that movement, just that movement of circling, brings lubrication into the joint. We're going to do the same thing on the other side. I'm going to turn so you can see that from a different angle. So the palms come under the shoulders again. Knees are under the hips. Lift the opposite hip. Yep, you're welcome to come down onto a forearm or the opposite forearm and see if your knee can be lined up or in the same plane as your ankle and your hip. So see if we can avoid this kind of action and have everything kind of lined up like a L or a 7. And then begin to circle. Right, notice where you feel that movement, that sensation. Good. And we'll rise up. Come to this shape I call standing kneeling. And you're welcome to use props here, like blocks or a low stool if you have them. I'm going to grab a pair. I like to use them for this next series of movements. If you have them, bring them right underneath your shoulders and step one foot forward. Yeah, good. Stack your shoulders right over your hips, your ankle underneath your knee. And again, I'm going to turn sideways so you can have that view as well. Get in sync with your breath, and on an exhalation, send your hips back, let your legs straighten, but not lock. We'll inhale and come forward. The knee will stack over the ankle, and exhale back. And like I said, having blocks is just an option. The height that the blocks are at are also just an option. So I like to practice this with blocks, so I'm going to come on back to using the block. Good. Find a focal point, something straight ahead. Let your palms rise up and come together in front of your heart. Begin to practice 3-part breath, which we've done a few times in these videos. So as you exhale, draw the belly in towards your spine, right? As you inhale, let the belly expand. So exhale in, inhale, expand. So when you do that, draw the belly in, you might notice some engagement here in this front thigh. Engagement meaning the muscle begins to activate, like you can feel that something's happening there. Let's bring the hands down to the block or to the floor, and we'll switch sides. Opposite foot comes forward. Come forward and back. Forward and back. And of course, you're doing this with your breath, coming forward on the inhale and back on the exhale. I didn't do this on the other side, but I'm going to give you the option to deepen this. So if that sounds interesting, you can take one or both of your blocks to the inside and see how that feels as you move front to back. You might even like bringing the hands to the floor. It might even be available to you to come down onto your forearms. So since we didn't do that on the other side, let's go back and see how that feels on this side. You can take it in stages without blocks, palms right to the mat, or down onto your forearms. Good. And let's bring the knees together. Place the palms right under the shoulders again. Curl your toes under. Take a breath in, and as you exhale, press up into a downward facing dog. Just a playing around down dog. We're really, for this shape, for this practice, just coming into down dog to give you a little more space to move the knee joint or move the knee and hip. Good. And then on the other side. And stretch the tailbone up to the sky as you send both heels towards the floor. Press into your fingertips. Let out your breath. Come down onto the knees. Set the knees wide on your mat. Bring your hips back towards your heels for a wide-kneed child's pose, where your head can rest on the floor. On stacked up fists. maybe a block. Let your hips do a little sway from side to side. Take a breath in and sigh it out. Let's stay here for 3 or 4 cycles of breath. Use your inhalation to press back up into table. Transition onto your sitting bones. Find a comfortable seat and just let your body integrate that hip opening practice we just explored. Notice what's different about your body now than it was a few minutes ago when we first started. What shifted or changed for you? Thank you so much for sharing yoga with me, joining me in this practice. Feel free to contact me with any questions or comments. Namaste.